Welcome to SuperDoc Stories, the place where physicians stop playing small and start building the life, brand, and impact they were born to create. I'm Dr. Marissa Caudill, physician, CEO, and co-founder of SuperDoc Tech. And if you're listening right now, something in you already knows you are meant for more than a packed clinic schedule, a shrinking sense of autonomy, or a career defined by someone else's metrics. Here at SuperDoc Tech Stories, we shine a light on bold, brilliant doctors who are stepping outside the traditional box of clinical medicine, the ones using technology, AI, and automations not just to run a cash pay practice, but to build movements, reshape their identities, and reach more people than medicine ever allowed them to before. Because in this new golden age of medicine, your expertise is currency. Your voice is public health intervention. And your story, it's the spark someone else has been waiting for. On this show, Mona and I share how we and dozens of superdocs just like you have used the right tools, the right strategy, and the right support to turn overwhelm into clarity, confusion into confidence, and ideas into income. We talk about the emotional cycle of change, the valley of despair, yes, you will go through it, and how the right community and technology can rocket boost you straight into that phase of informed optimism and fulfillment. So if you're a physician building a cash pay practice, if you're dreaming of coaching, consulting, speaking, or creating, if you're ready to stop exchanging time for dollars and start scaling your wisdom, you are in the right place, and we want to hear your story. If you've got something powerful in the works, apply to be featured on this show by going to superdoctech.com/podcast-booking. We want to celebrate you, amplify you, and help you shine brighter than ever. All right, SuperDoc, let's dive in. Your next chapter starts now. Welcome back to SuperDoc Stories. I'm your host, Dr. Marissa Caudill, and I am thrilled today to be having Alison Curfman join us. And she has just the most incredible story. I saw her speak at the PIMDCon conference this past September. Welcome, Alison.
Thank you. Thanks for having me.
So you are a ER doc or pediatrician by training?
Both. Pediatric ER.
Okay. Even more specialized. Awesome. And so tell our listeners your story and tell us kind of the timeline of how you ended up where you are, because it's just incredible.
Sure. So like you said, I'm a pediatric ER doc. I'm still practicing. I work in several different ERs because, seeing patients and being a doctor is really important to me. I actually really like taking care of kids, but my career has taken sort of a sideways turn into the world of venture and startups. And it really all started for me when I was in fellowship back in, I feel like it must have been like 10 or 12 years ago, when telehealth was not very common especially in peds, like it just wasn't being used very much. And it was considered like this very disruptive, innovative technology for healthcare. But I had a really difficult case of a toddler that presented to a rural hospital with no pediatric support. He was really sick. They knew he was really sick, but they didn't know what was wrong. And they thought the best chance he had was to get him to pediatric care as fast as possible, like put him on a helicopter. And they called me, and I just had so little information. I didn't have a history or physical, or they didn't have vital signs. And unfortunately, he had an unrecognized head injury and herniated on that flight, and he died. And I remember thinking this was so senseless. If I could have only seen him and actually spoken with them and evaluated him over something as simple as video, there may have been temporizing measures we could have done. And so that was my first kind of entry into health tech, is how do we make telehealth work for kids? And it was very clear that it was all tied up in the fact that there was no payment for it, liability wasn't figured out, there was no policy around it, and there was really no evidence base for it. So my first thing that I started was a multi-center research network. It was a nonprofit called Sprout. It's now part of the American Academy of Pediatrics, but that was really my first little mini venture because I was really trying to identify how can we rapidly create an evidence base for this so that we can get the right policy, so that we can get payments, so that people can have this tool available in their practice. And I go back to that story because there's so many other things changing in healthcare now. And now telehealth seems kind of like obvious and normal. But I just like to remind people that even 10 years ago, we were not using it regularly.
Well, and even now, okay, but I want to pause for a second and go back to that because you just kind of, and then I did Sprout, whatever. But I know it wasn't really just like that easy, right? I mean, I'm sure, so you were in training, you had this idea. I know 10 or 12 years ago, there were people who were like, yeah, whatever, just keep your head down, do your thing, right? Like stay in your lane. So how did you listen to that whisper inside of you that was telling you like, I can do this? How did you know it was you who could do it? How did you silence the voice that was like, who are you to do this?
I mean, I definitely had a vision for working a lot on healthcare delivery models because when I was deciding my fellowship project, I was like, I want to try and figure out, how to study like what makes people come to the ER when it's not the best setting of care. And my program director or someone high up in the department was like, you will never fix that. You will never solve that. You need to put your head down, pick a disease and study that. And so, but with Sprout, this is going to be like some tangible advice for people. It really came from, I was at a meeting. It was my, pediatrics meeting. And I went to a talk on telehealth and went up and talked to the speaker afterwards. We both had like very similar ideas around what potential this could have for our field and what the barriers were. And then a couple other people joined in the conversation and we ended up like sitting on the floor in the hallway of this convention center and meeting up multiple times over the course of this meeting. And those 4 people, we formed the, initial, research network. Cause I mean, it was a very academic thing. We're all in academics and we're like, we need more evidence. And so, sometimes things just organically unfold and you don't have to actually have a plan for like, oh, I'm going to found something. And so that led to a lot of policy development. I wrote the AAP's policy on telehealth. And then it opened up new career doors for me because my first role out of fellowship I took was as a medical director for virtual care for pediatrics for a large hospital system. And I thought that was like the coolest job I would ever have in my life. I thought that like, oh, I'm going to be in this job forever. I can grow this. I was working clinically and had this other role that was more like innovation and program design. And it was a great role and it was a great fit for that time in my career. We had some budget to create a number of different telehealth programs. And one of our core programs was a population health program for children with medical complexity. And for me, I could see that these kids, this very, very small proportion of kids, make up a massive amount of pediatric spend and Medicaid spend because they spend so much time in the hospital and their care can be so hard to coordinate. And so that was my first real initiative at this program was to build a virtual care program, a new model of care for these kids to try to find ways that we could literally just support their parents more. I mean, telehealth's a great way to have conversations and support parents. And so we were helping make sure that all of their needs were met, their meds were filled, their appointments were made, they didn't have questions. And our goal was to prove that by providing these families with more support, we could keep them healthier and out of the hospital. And so I was very academic. I did a research study on that and got an IRB and we ran this program for a couple of years, ended up with about 200 kids in the program. They were all like trach vent G-tube kids and we were supporting them all virtually. Now they still had their own pediatricians and specialists that they saw in person, but we were just providing this wraparound layer of support. And we showed that just by supporting them more, we were able to reduce their hospitalizations by 35%. And cut their ER visits in half. Yes.
And like the dollar signs that you're saving with that are just enormous, right?
Of course. Yeah. I mean, I think we saved Missouri Medicaid millions of dollars on this very small cohort of children that they definitely noticed. Like I got to know the director of Medicaid for my state. They were very encouraging. They made it very clear, like we have no real programs or solutions for this type of patient. And it is a real need. So it was essentially a pilot and we got paid nothing for the pilot because if you're building something new, again, similar to the whole discussion about telehealth, there wasn't a payment model for it. Right. And so I found myself right back to that place again where our goal was get the data, get the evidence, prove that the model works, and then we're going to use that to create probably like some individual contracts with our payers to try to support the program and grow it from there, because it really needs to be a value-based model, right? So if we're saving them millions of dollars by providing an intervention, then we need to, create a aligned incentive to share in those savings. Unfortunately, COVID hit right around the time that we were publishing our results, and it was like everything changed overnight in the healthcare system. And people are like, well, why would they stop a virtual care program? Everything switched to virtual. It's like, yeah, but the hospitals all ran out of money. Like they stopped surgeries for 2 weeks and all of a sudden every hospital was out of money. And so they did massive cuts of programs and teams and layoffs. And this program generated $0. It was a proof of concept. And so it was unfortunately ended during COVID. And I remember just being so devastated because not only because like it was over, but I was still working in the ER, and every shift I was seeing these kids come in who I had previously kept out of the hospital for 2 years. And I was like, oh my gosh, you have a ventilator and a trach, and like there's COVID here, and this is the absolute worst place for you to be. And I remember being at a point where I was like, wait, what happened? This was supposed to be like the job I was going to have forever. And like, now it's over.
Yeah.
Now
that was a low point.
Yeah. It was a point of reflection for me.
It was a transition point. Yeah.
I wasn't laid off. I was moved into a different role, which was actually like, I was a higher level role in the healthcare system, because they did need a lot of operations around implementing telehealth across all of our 45 hospitals. And I hated it. Like it just didn't feel meaningful. It wasn't that super mission driven work and I had built this team, and I realized like I didn't think I was in the right place anymore. And I think sometimes people get to that point, but they just put their head down and keep going.
Right.
Because, well, I mean, I did for a while. I was like, well, I mean, I'm not going to like quit my job. But then my co-founder of the company I ended up starting, she was more technical. She's non-clinical. She had run the program with me and moved on to another job when the program ended. But we stayed in touch, and she was like, we got to get back to this work. We know it was working. We know it was meaningful. We know there's need for it, and what a big difference it was making for all these families. We can make a business case for this. Like, why don't we just do this on our own? And that was like a very fear factor thing for me. I was like, I don't know how to do that. I have never like not had a job. Like I didn't sign up for that.
And what year was that?
That was in 2020, early 2021. So the program ended mid 2020. And then I did this other operations role for a while. But we kept thinking through like, what could we do to start this on our own? And I think what we sort of landed on is that we would start our own medical group in Missouri. And, I had all these contacts at the state level. We were thinking we could negotiate some sort of a starting contract. We didn't exactly know what we needed, but we actually started with a local startup accelerator, which most people don't even know what that is, but there's all sorts of resources for entrepreneurs they're like nonprofits. So we submitted a pitch deck and we met with them, and they accepted us into like a coaching program. So, I mean, they provided us with like a lot of feedback and some guidance, but not like funding or anything, just kind of having someone on the inside who, as opportunities came up for us, it was like, oh, we have someone we can ask about this, because I didn't know anything about startups. I have this joke that I literally got the book Startups for Dummies and started to read that. But then right as we were at this point where we made this commitment to each other that this was the work we wanted to be doing, and we were willing to take the risk and like actually quit our jobs to do this and try to make it work, I was contacted on LinkedIn by a top healthcare firm in Nashville that actually was looking to invest in complex pediatrics, and they found my publication.
It's like kismet.
Yes, I know.
But I love that, this is a common thread. I've interviewed now, I think like 5 doctors for this podcast. So the common thread is the pandemic was kind of this like
Shakes everything up.
Yeah, it was like the pressure built up and it turned something that seemed like crap into diamonds, right? In an unexpected way. But the other common theme is that you and all the other people I've seen and talked to, myself included, we were frustrated with the status quo, medical care, dealing with just problems after they've already happened. And we wanted to go upstream. And it's like you saw this opportunity, like a little bit of effort upstream leads to huge savings downstream, and not just the financial savings, which is great to sell your business and get venture capital and all of that stuff, but like the experience for the patients and the families is night and day. And that's really what's driving you.
That's absolutely what was always my driver and still is like, I am really motivated by impact. And initially, I felt like, I'm having an impact on the world by being a pediatric ER doctor. I love seeing kids. I feel like I've definitely like saved kids' lives, and I not all the time, but in the past I have, and I feel like I'm very highly trained for that. I still love that. It's not a choice between clinical medicine and doing other things. I do both, but I was really realizing how much more impact I could have by building initially what I thought of as programs, but now I think of as businesses that are a redesign of how we do healthcare, because so much of what we do is so broken and we really understand it. Like as doctors, we know where the broken parts are and we kind of power through them, but we have really deep perspective on solutions for some of these problems.
Yeah, 100%. And I think what's so inspiring about you is that just a few years ago, you were like, can I do this? I don't know if I can do this. And then tell everyone like how it turned out and what's going on with the company that you've started.
Yeah.
That started this, 3 years ago officially?
I think something like that. So it was late 2021 when I literally got this message on LinkedIn. This is another thing. You guys should all be on LinkedIn because I know doctors don't tend to use that as much, but it's like the most enriching opportunity for networking outside of medicine. So I got this message on LinkedIn from an investment professional at a firm in Nashville. We got on the phone like a couple days later, and I was on the phone with the CEO and founder of the firm who has started multiple massive healthcare companies. He used to be the director of CMMI. Like he has he has a great reputation in healthcare space, but he always wanted to figure out complex peds. He felt like there was an oversight there that the market wasn't creating solutions for them. And so, like within like a few minutes of being on the phone with him, he's like, "Hey, you guys want to come to Nashville and build this with us?" And we were like, whoa, I don't know about that. And he was like, "Oh, sorry, we just met 5 minutes ago. Why don't you guys come down to Nashville? Why don't you come visit? Come meet the firm, meet everyone." And so we flew down. I think that was on a Friday. We flew down on a Tuesday.
Amazing.
And I remember meeting everyone at this firm, realizing this unbelievable amount of like expertise and support we would have if we decided to partner with them. And so my co-founder and I remember us like calling our husbands and being like, how we were going to quit our jobs? Like, can we actually all quit our jobs and move to Nashville? And so instead of just Megan and I quitting our jobs, we all, 4 of us and our husbands, and we brought 7 kids with us between the two of us and moved to Nashville. That was like late 2021 when we first developed the relationship with the firm.
Wait, your husband, what does he do?
He's a neurologist. So he had a practice. He's the best. He's really very supportive.
Well, obviously. But like, so he just blew up his life trusting that he could restart it in Nashville. Yeah. And what about her husband?
He actually was able to do a lot of it remotely. And but I think he had to have some career changes, but yeah, and both of us, like all of our family was in St. Louis.
And this is in the pandemic still.
Yeah. Yeah, we thought we were going to be homeless because the housing market was insane. And I was like, we have 4 kids and an au pair and 2 large dogs. And I was like, we can't live in an apartment. I don't know what to do. But we got a house, we got settled. We moved pretty quickly. My husband had to give 90 days notice, but we actually did let the kids wrap up the school year. So I was commuting for that first few months. It was so interesting working in this firm because we were really de-risking the concept. I was pitching all the time to insurance plans. I was creating our entire model for like how we were going to care for these kids clinically, and our selection algorithm of which kids we were going to take risk for. And It was so eye-opening. It was the best learning experience I ever had. I knew that even if the company never launched, I would be in a better career place having worked there and had this experience than if I didn't go. Let's see. We got our first contracts at the we incubated the company in 2022. And then end of that year, we got these massive contracts in Texas to launch with about 20,000 patients in that first quarter. And so then we're looking around, we're okay, there's 3 co-founders at this company. I'm the only clinician at this company, and we have to start taking care of 20,000 kids in 3 months. So we hired a ton of amazing people. We trained them. It was this totally startup on steroids excitement feeling. We grew from 3 co-founders to over 300 employees in about 18 months.
That's crazy. Oh my gosh.
Yeah.
Wow.
So it was this totally rocket ship experience. And it became this huge operating company, became a large medical group, very complex. It was all about I had built the model, and now it was all about implementing it. And all of a sudden I realized again, this was not actually my best and highest purpose. I hired someone who succeeded me as chief medical officer, who had a lot of experience running large medical groups. And I was more focused on, new concept development. But it became clear that those were not going to happen within Imagine. And so I ended up handing off the reins and moving into an advisory role and starting my own consulting and advising firm where I'm working with venture firms and startups on their models and design and their clinical design and then their go-to-market strategy. And I've been able to contribute to a lot of other because the building year of Imagine was my sweet spot because that's what my skill set is. As far as managing 400 people and getting them to deliver on a goal, there are other people that were more qualified for that than me.
Wow. Well, your story is so inspiring, Alison. Thank you so much for sharing it. Let me ask, if there's someone listening to this and they're just well, it must be nice for her, or they just can't imagine that this would be their life, what would you tell them? I mean, would you have ever imagined 5 years ago that you are here where you are now, having founded this company and seen it launch and worked with these? And obviously, it's something you didn't do alone, right? This was a huge group initiative with a lot of different expertise coming together, but with a shared mission and desire.
Absolutely. No, this was not at all on my roadmap or plan or anywhere close to anything I would have ever imagined for my career. But I think what I have is this ability to take opportunities when they come and be willing to do stuff when I don't necessarily know what the outcome might be. I think a lot of doctors are naturally pretty risk averse, and I'm not I don't know, I'm not overly risky. I think I'm okay with calculated risk. Like I said, I knew there was a chance Imagine would never launch. And I would just work at this firm for a year and relocate to Nashville, and then it just wasn't going to launch. But I kind of calculated if that happened, what would be the benefit? I think I could move into other positions and have this interesting part of my career. So, and I also can always be a doctor. I still am a doctor. I mean, I still work in ERs. And so I think that you have to be willing to take opportunities that come your way. Imagine has grown so much. We now, as of January, I think we're going to have close to 100,000 kids that we're taking care of. And these are all kids on Medicaid. We are providing them this unbelievable level of care. They've never had this sort of attention or care before. And we just raised $70 million to take the company nationwide, reached a multi-9-figure valuation in just 2 to 3 years. And so what I'm working on now is really, how do I actually help other physicians find these pathways as well? Because for me, it came with a LinkedIn message and then a willingness to take a leap, but there's not a really clearly defined pathway. It's not like you could be I want to take a fellowship in venture capital. And so one of the things that I've been working on, I built a business called Startup Physicians. I too have a podcast, and I've been working on, finding ways to create pathways for physicians to get involved in startups, either as super low lift, as an advisor, or even as a consultant. And for those of them that have a good idea and are man, I wouldn't know the first place to start with this, but I really know I want to solve this problem, really supporting physicians who want to become founders. So that's what I work on now, in addition to the new concepts that I'm working on with the firms I work with. But I would love, if anyone is interested in learning more, to reach out to me on LinkedIn or go to our website. It's startupphysicians.com.
Great. And we will put that in the show notes, everyone, so that you can reach Alison. And she is just the most down to earth, the most generous person that I have met. So thank you again, Alison, for talking with us and for sharing your story. And again, congratulations on what you participated in building at Imagine. I mean, I can't imagine the impact that's going to have 100,000 kids and growing. Just think of all the lives you're saving for those kids with high medical needs. It's incredible. It's got to feel so good.
Thank you.
Yeah.
It doesn't. I'll end on this note that I realized that by building a business, I was able to have, like, when I see kids in the ER, I have a one-to-one impact. By building a company, I had a one-to-many impact. And now I want to have like a many-to-many impact. I want to help other physicians find their pathway to have this one-to-many impact. So thank you again so much for having me. I appreciate it.
Yes. Thank you. Thank you. All right. Take care.